Good afternoon. Welcome to our weekly update on COVID-19 response in St. Joseph County. I'm Mark Fox, the Deputy Health Officer for St. Joseph County Department of Health. I'll give an update on the data that we have currently. So through last night at midnight, we have 541 cases of COVID-19 in St. Joseph County. We're beginning to look at some different data elements that you'll see in this week's summary. We know that obviously more than 541 people in the county have been infected with coronavirus. One of the best measures of burden on the health system and severity of disease is through hospitalization data. So currently there are 45 individuals hospitalized, either with a confirmed COVID-19 infection or individuals who are what are called PUIs, or patients under investigation. And the breakdown of those, 21 patients with known COVID-19 infection are currently hospitalized. 24 are individuals who are under investigation. We've had 13 deaths in St. Joseph County attributed to COVID-19. One of those deaths occurred in the St. Joseph County Hospital, was an out-of-county resident, so there are 12 St. Joseph County residents who have died due to complications from COVID-19. There's been a lot of attention to testing and discrepancies between what we report and the data lag to the feed to the State Department of Health. We have working with our health system partners, we've changed the query to shift from tests in St. Joseph County, which again serves a much broader network than St. Joseph County residents, to focusing on the patient's county of residence. And so adjusting that query, there are at least 5,531 tests performed on St. Joseph County residents. I have an asterisk by that, one, to indicate that our query behind that has changed, but also to indicate that we believe that this number is accurate, but it's likely not complete either. There likely are St. Joseph County residents who similarly have been tested in other counties that have not yet been reported. And there are some other providers in the community that are doing tests that may not be fully reported in this number. But at a minimum, 5,500 tests that we can attest to at this point. I still am waiting for further explanation from the state as to where the lag in their numbers comes from. Clearly, there's evidence that some of the lab reporting can lag by 7 days or more. Our average days to test result continues to improve. Again, this is taking all the tests done in the county, and the average days to result now is 2.5 days. We've had just under 200 cases of COVID-19 per 100,000 residents in the county. Now I'll go through the data for overall cases and then hospitalization data, and we've also added data on fatalities attributed to COVID-19. So slight majority of cases are in females. The age distribution stays stable here. So even with the outbreak in a long-term care facility, the majority of cases are 60% of cases are under age 50. There has been a shift in the racial and ethnic composition of confirmed positive cases. So about 51% of confirmed cases are in whites. African Americans have been fairly stable at 15% over the last couple of weeks. A significant bump in cases among individuals who are Hispanic. We've also had, several initiatives to increase testing on the west side of the county and to improve access to individuals in that region, and that likely is at least a contributor to that increase. Now shifting to data on individuals who have been hospitalized. Here a slight majority of hospitalizations are in males. This is the age breakdown here. 74% of hospitalizations are in individuals over age 60. So it's a reverse of the distribution of cases. And this is the racial and ethnic composition. So nearly half are in whites, disproportionate share among African Americans and among the Hispanic population, despite the increased number of cases, a smaller proportion of those requiring hospitalization. And for the first time, we're reporting data on the fatalities. Again, this reflects data on all 13 individuals who have died in St. Joseph County attributed to COVID-19. So here, nearly 60% of decedents are male. 77% are over age 70. There have been no fatalities in individuals under age 50 in St. Joseph County attributed to COVID-19. And then the 50% are white, and here again, disproportionate burden among the African American population. This is the same slide we've been showing the last several weeks. It's the cumulative number of cases over time in relation to the travel advisory and the stay-at-home directive. Again, you can see that while the number of cases obviously continues to increase, the rate of rise or the steepness of that slope has continued to decrease. That's captured here as well. This shows the number of cases identified by date of test result. We've added the 5-day rolling average with the dotted line, so you can see a decrease in the 5-day rolling average, although we have not yet seen a steady decrease in the number of cases. So there's still quite a bit of variability here in number of cases identified each day. And again, this is the slope, the growth rate in St. Joseph County superimposed on this slide from other national data. But again, the doubling time now is about 11 days, doubling time is about 13 days now. So we have seen a nice decrease in that slope. And then this just reflects the average time to test result. So again, early on in our experience, things were taking 7 days or longer. We've been consistently right around the 1 day time to test result. So that's markedly improved. So just a couple very quick comments about this. Again, to emphasize, we have improved access to testing for individuals living on the west side of the county. I think that contributes to some of the data that we're seeing here. Our hospitalizations actually have decreased. So a week ago we had 50 individuals in the hospital. Now we have 45. We'll continue to monitor bed usage as, again, a good indicator of not only disease prevalence but also disease severity. And while there's a lot of attention to, when can we reopen, what can we do in that regard, we still have not seen a consistent decrease in the number of cases. And regardless of what that timeline looks like, a lot of these mitigation strategies will still be necessary. So attention to physical distancing, even as operations reopen at some point, physical distancing will still be an important strategy to control the spread of coronavirus. In addition, we need stable access to testing supplies and personal protective equipment to perform tests. We need to grow our capacity in terms of contact tracing so that we can respond quickly when a new case is identified. And we need consistent capacity to care for individuals requiring hospitalization with COVID-19. So there are still a number of important challenges that will need to be met as we transition in whatever time frame that is to thinking about reopening. And I'll turn it over to Mayor Mueller. Thank you.
Thank you, Dr. Fox. And first want to start out just thanking everyone for the sacrifices they're making at home. I know this is challenging, and I myself am also tired of not being able to go places or see my family and friends. And so unfortunately, we've got a ways to go still, and I know we'll get through it, and hopefully the good weather will help us get through that. Also, thank you to those on the front lines who are really putting themselves in harm's way to keep us all safe. We owe forever a debt of gratitude to the important work that you're doing. And again, I have a desire to reopen and really start rebuilding the economy. We know what a disastrous impact this has had and is having, and the sooner we can get open, the sooner we can get that back on track. But we can't open too early, or we'll have ruined all of the sacrifices that we've made so far. And the next few weeks are critical to success. So as Dr. Fox said, we're wanting to see at least 14 days of declining case numbers that we haven't seen so far. We are closely watching what's happening with our hospitalization rates, because that's the best data we've got. We also need to make sure we have the infrastructure in place to reopen, and that includes a robust contact tracing program that we're working to establish. And so even if the cases were going down right now and we were ready there, we're not ready on that piece to get it open. But we think by the time that we're able to reopen based off of the cases going down, we should be ready on that front. And so there's a lot of talk about that, and that's something that's going to be a focus for us in the coming weeks. And I hate to use a sports analogy because they're overused in politics, but this is, and we're also looking forward to football season, so we'll use a football analogy here. We've got to score a touchdown. We don't have any time. We don't have another drive left. And we've been eking out first downs, gadget plays, fake punts. And now as we're approaching the red zone, can't settle for that field goal. We need the touchdown. And we certainly can't turn the ball over on the goal line. So let's make sure we run through and punch through and score that touchdown. And here's a bit of disappointing news. The models are suggesting the peak here may be later than we had talked about. So late May, early June is probably the earliest, the optimistic time frame for reopening at this point. And as we continue to manage the economic fallout from keeping our neighbors safe, the city is going to host another emergency business assistance fair on Tuesday at 1:30. And with that, we'll turn it over to Commissioner Andy Castelny.
Andy, you're muted. If you would be able to unmute yourself.
Commissioner, you're muted.
Andy, you're muted. If you could unmute yourself and start over.
He's being incredibly eloquent.
Yeah, he's doing a great job, by the way. We can read lips here, but sure. Let's move to State Senator David Niskotsky for an update for the state.
Mayor, I want to say thank you for asking me to be here today. I appreciate the opportunity to give a brief update on some of the most recent information that the state has to offer. And Dr. Fox, I thank you very much for your update. So unemployment, weekly claims have dropped this week to 75,483. And that's down from 118,184 last week. As of today, we have over a half million claims that have been made so far for unemployment assistance. More than 1 million payments for an amount of $470 million have already been made in the state of Indiana. Concerning pandemic unemployment assistance, or PUA, for those who traditionally wouldn't qualify for unemployment benefits, such as independent contractors, self-employed and gig economy workers, they can begin making their applications today. Payments are targeted to begin on May 8th. Applications will be available in the online filing system, Uplink, on the IN.gov website with DWD for those that have filed for and been denied regular UI. You must first file and then be denied before you become available to apply for these PUI application. You will have a to-do list on your claimant homepage to complete your application. You'll also be able to file weekly vouchers. You will have to file all past vouchers and file weekly vouchers moving forward. 21 days will still be the average time for unemployment claims to be paid out. Concerning testing, Dr. Christina Box, Commissioner of the Indiana State Department of Health, said the Food and Drug Administration authorized home collection tests that will also be available in most states via doctor's order in the coming weeks. Dr. Box said the home test will work best with asymptomatic patients. Concerning mortgage payment assistance, Lieutenant Governor Suzanne Crouch has stated that the state has reopened its hardest hit fund, which can provide up to 6 months of mortgage assistance. For more information, you can apply at their website at www.877gethope.org, or you can phone 877-GET-HOPE. I'd also like to take this time, as Mayor Mueller did, to remind everyone that every time we hear or see someone from the healthcare industry, from public safety, police and fire, and all those that serve on the critical front lines of working to help keep us alive and healthy, to remember to say thank you. Every time we walk into a grocery store or see a mail delivery person, someone volunteering at a food bank or pantry, any essential worker, let's remember to thank them too. I want to also let you know that through the last several weeks, my Senate caucus and I have sent a number of comprehensive letters to Governor Holcomb. Just recently, we highlighted the need for enforcement of greater protective measures for essential workers working in factories and industrial facilities. There have been many reports of Hoosiers who have having to work without proper protective gear or without proper social distancing measures. If you feel unsafe at your workplace, please be sure to reach out to my office at s10@iga.in.gov. In another letter to the governor, just this week I joined Senator Mark Stoops from Bloomington. Senator Stoops and I urged Governor Holcomb to do everything in his power to help keep disability service providers operating during this pandemic, such as Logan Center. We expressed the need to prioritize access to PPE for these crucial services and to use federal coronavirus relief funds to help these facilities stay open. We've also expressed concern for the substantial burden which has been placed on all of our not-for-profit agencies here in St. Joseph County, such as United Way, and La Casa de Amistad, and so many numerous others. Finally, concerning voting in the primary on June 2nd, the deadline to register to vote is May 4th. You can do so online at indianavoters.com. Any Hoosier can request an absentee ballot for this primary election. There will be an online application available soon, also at indianavoters.com. Or you can call the St. Joseph County Absentee Ballot Office at 574-235-1812. Remember that you must signify your party in order to receive the correct ballot, and you must sign it. So with that, I appreciate again very much the opportunity to provide an update, and we'll continue to work, and I stand ready to go to work tomorrow if the governor should decide that it is time that we may have to do more.
All right, we'll try this again. My wife says I always sound smarter muted. I took a little bit much to heart. The COVID-19 assessment tracking and triage tool, CAT, is a new website that we're looking to roll out that will hopefully allow residents to assess symptoms and exposure related to the coronavirus. Users can input how they feel and other risk factors to receive general advice about what to do and where to go to get services they may be in need of. CAT will hopefully provide more reassurance and information to the public while reducing the burden on our dispatchers and first responders. We remain in daily contact with state departments, local healthcare facilities, local businesses, and various units of government to make sure we are properly coordinating our efforts. I think we remain one of the best examples across the entire state when it comes to coordination of care and taking care of our community. I want to especially thank State Senator Nitskotsky and State Rep Dale Devon, who are in constant communication with us and keep us updated on things that are happening at the state level, and most importantly, are fighting at the state level to make sure that St. Joseph County has what it needs. As the mayor mentioned, as we began planning to reopen our local economy, please remember this is more of a garden hose than a fire hose. And that faucet is going to be turned on very, very slowly. As we receive more guidance from the governor's office, it's important to remember that it will take months and months for things to return anywhere close to pre-COVID-19 levels. For example, once a restaurant opens, it's very reasonable to expect that they will be severely limiting the number of patrons allowed to be in. Other places that open, same thing, very limiting the number of people that are going to be allowed to be there. There's going to be a high level of personal protection equipment required in order for those places to open. So masks and gloves and those things are going to be constantly needed. As we begin to think more fully about opening government offices, it's very likely that the public will not be allowed to interface directly once these offices reopen. We're trying to keep providing the level of service that's necessary for our citizens, but also keep our employees and our community safe. As has been said, there is no playbook for this. Hopefully we are reaching the red zone. That would be great. But we know things are going to continue to be a little messy and difficult at times. But we need to continue to do everything we can to keep our community safe while providing the services that our citizens need. Thanks to everyone who works tirelessly to keep our quality of life strong and to keep us safe. But it's important now more than ever that we keep playing our part socially and physically distancing and doing everything we can to keep our community safe and be patient as things reopen, because it's going to be a very long process. Thank you.
Great, thank you, Commissioner. The speakers ahead of me have said this very well, so I'll only offer maybe a couple of final remarks. And obviously, we have a health crisis and an economic crisis that are really intertwined. And obviously, the conversation this past week has really been related to this reopening of the economy. And as everybody said here, I think we really need to temper those expectations a little bit. The current stay-at-home order goes through May 1st. And we'll see guidance from the governor either today or early next week on what exactly that means. If we look at the states around us, Illinois has extended theirs yesterday. Michigan also is intended to take some action today. It's really important that we watch what our neighbors are doing too, because this virus doesn't know political boundaries. And so obviously the business community is really interested in seeing the economy open back up. As Commissioner Castelli just said, though, this will likely be in phases, and we're expecting some clear guidance from the state of Indiana in particular in this next week related to businesses as they open and who can open and what some of the guidelines are related to that. One thing maybe we didn't touch on yet is the federal government took some important action this week to throw some additional assistance towards businesses. Congress yesterday passed the next phase of the CARES Act. We had a number of local businesses in particular waiting in line for funding when that last round of funding ran out. So we're appreciative of the tireless work that Senator Young and Senator Braun and Representative Walorski have done on behalf of businesses here in our area to try to bring more dollars and resources. That next phase also did several other things. It brought more funding for testing and some additional assistance on a variety of different levels, I think, that are going to help us continue to fight or combat that. So again, I think they all mentioned I'm really impressed with the really talented local team that we have working on this every day on the front lines, and certainly those frontline folks in the hospitals, our medical providers are doing a phenomenal job there, but local government has responded, and it's kind of a catchy phrase to talk about we're all in this together, but that's what I really see here, and we're so grateful for Dr. Fox and the team at the health department and the leadership they're providing, and then everybody else that is really rallying around this cause. We're going to get through it, and we just got to sort of all work together, and we got to remember that when businesses do open back up, it's not like this is completely over, and we're going to have to continue for some time to make sure we take proper measures in our workforces and in our personal lives to make sure we minimize the ultimate spread. As I mentioned last week, we don't want to go through this again, and there's a likelihood we could if we don't respond well to this. So it's really on everybody here to do their part in the next several weeks to make sure that we get through this. So I'll end my remarks there, and I think we're all happy to take some questions if you have some questions. Caleb?
So we'll open it up for questions now. I'm going to read off for each reporter who's on the call. We'll start with ABC 57. If you want to go ahead and unmute yourself and ask a question. We'll move to Anna Caroline Caruso with WVPE. Anna Caroline, if you'd want to unmute yourself and let us know who to direct your question towards.
Yeah, this question is for Mayor Mueller. If Governor Holcomb gives the okay for the state to start reopening, let's say May 1st or even early May, is that still up to the county's discretion? Like, if you and Dr. Fox feel like it's still not safe for St. Joe County to open up, can we wait longer than the date that Governor Holcomb gives for the entire state?
So, but we acted before Governor Holcomb acted here locally with the county commissioners and the city of South Bend, where we put into effect a non-essential travel advisory ban. And that's something we could look at. But the best tools for staying on top of these stay-at-home orders are at the state level. And every indication that we have is that the governor is going to do right, not just as the state as a whole, but across the state and for regions in particular. And so if we are lagging behind the state in terms of where we are in cases, that we need to stay closed longer than some other areas of the state, I would expect the governor to work with us and figure out how to make that happen.
Okay, perfect. And then I have one more question for Dr. Fox. You showed some of the new data today on demographics and spoke a little bit about some of the disparities there were in testing. Can you talk about, obviously that has improved slightly, but are there still improvements to be made? And if so, how does the county plan to reach more minority groups to improve testing?
That's a good question. I think we have, the data suggests that we have markedly increased access to testing for minority communities. One of our real goals, though, in the coming weeks is to improve our outreach, particularly within the Hispanic community. We've gotten some feedback. We have done some outreach through the Chamber of Commerce there, the Hispanic Chamber of Commerce, and through the radio station, but we feel like there are improvements to be made in messaging, both around the mitigation strategies and the importance of physical distancing, as well as ensuring that people know where they can access testing.
Okay, all right, that's all I have. Thank you, guys.
Now we'll move on to Jeff Parrott with the South Bend Tribune.
Yeah, thanks, guys. My question's already sort of been asked. There's anything more you can say about what you might do if you think Governor Holcomb wants to reopen the state's economy before you think we're ready to up here in the South Bend area?
So, I just say that we're going to follow the data and the recommendations from our health officials and do what's right for our residents. And we hope, again, that the governor will be supportive, and that's our expectation. If something changes there, we'll have to reassess then. But right now, we expect Governor Holcomb to do what's needed for St. Joseph County residents.
So what does that mean? Like, are you saying that you would ask for a separate consideration for this part of Indiana?
If he's looking to, if some other areas of the state are farther along in terms of, they've passed their peak early, or they hit their peak earlier and passed it, and they are looking to be ready to reopen before we are, then we would expect that the state would accommodate regional solutions.
Do you think we should go along with what Michigan and Illinois are doing in extending their stay-at-home orders?
Well, that's exactly, the governor's already said that he's going to coordinate with neighboring states and their governors. And so the fact that you see things happening in our neighboring states should be an indication of what we might expect going forward here in Indiana.
Okay, thank you. Good for me.
We'll circle back to ABC 57. With that, that's all the reporters on the call today. So thank you for tuning in, and have a nice weekend.